We're so excited to hear that you've booked your surgery with us here at Watt Plastic Surgery.
We're going to go through a few important details as far as your specific surgery and things that you need to know ahead of time so that you're able to have the best recovery possible.
We've created detailed videos for each procedure. So you've just had chin liposuction. What are some of the expectations and recovery instructions? For chin liposuction, there's typically a small poke hole incision in the bottom of the chin and one on each side within where the earlobe meets the neck. It's important to note that you will be very swollen after surgery and almost look like no liposuction was done. This is totally expected, and it's because of the fluid that we place in the neck in order to process the fat. You'll have bruising along the neck and under the chin for typically 1 to 2 weeks. You'll be sent home in a chin strap, which you'll wear 24/7 for a full week. It's important that you wear as much as possible in the month following, but understandably, you have to go out and go to work and things like that, so placing it back on once you get home. As far as exercise is concerned, if chin liposuction is the only procedure that you've had performed, I allow my patients to return to exercise by 2 weeks. If you've had other procedures, including upper eyelids, breast surgery, or anything else, it's a full month. After chin liposuction, because of the suction cannulas being near the delicate nerves of the face, it's not uncommon to have some slight weakness in your smile for a couple of days to a few weeks. This is normal and will go away with time. Trust the process. One of the most important things with chin liposuction is that a good result can be attained in the operating room. A great result takes massage. With your surgery included is one lymphatic post-op massage here at Watt Plastic Surgery. After that post-op massage, I typically recommend that my patient purchase a package of at least 3 massages so that you are able to get 1 a week for the first month post-op. If you're not going to purchase the packages, it's important that you learn how to appropriately massage the area to remove any lumps, bumps, or swelling that can occur after surgery. By massaging the area, we remove inflammation and swelling that occurs after surgery. Starting the day after surgery, you're going to apply light pressure under the chin, pulling backwards towards the lymph nodes and down towards the neck. This helps relieve inflammation and swelling and provide a smoother result long term.
So we've gone through all the things that you need to know for the specific surgery that you're having. Now, just a general list of things that you need to know, kind of regardless of what surgeries you're having or what surgeries you're thinking about having in the future.
Never use a heating pad after surgery. We do not want you applying any heat to the area.
That also goes for hair dryers and ice packs. Even though ice is not heat, it can still burn you and leave very not great looking scars.
No sexual activity for at least 4 weeks after any surgery.
No exercise. And I know exercise is, especially in South Tampa, everybody wants to do something. They want to exercise. They want to be out and about. You need to not. And exercise means no going for a walk, even around the block. No walking your dogs, regardless of how big or small they are. No weights on your lower body if you just had upper body surgery or vice versa. No yoga, Pilates, nothing. If it's something you have to think about whether or not we would say, yes, you can do it, you can't.
No swimming for at least 4 weeks after surgery and no baths. For optimal healing, it's important that you avoid smoking or vaping for at least 4 weeks after surgery. It's a really exciting time in the medical field with the age of GLP-1 medications. With that, we've got a couple restrictions and recommendations to ensure you have the best results possible with your surgery. With surgery, you're investing your time, money, and recovery to have an amazing result. But if you continue to lose weight after surgery, you may have excess skin that recurs that you'll want to remove. We want your results to last, so maintaining a stable weight within 10 to 15 pounds is crucial to ensure a lasting result.
If you're considering a tummy tuck or a breast reduction or breast lift, and you're considering losing more weight before you would want to have that surgery, you can have a consultation with one of the members of our team to talk about the GLP-1 medications and if those could possibly fit into your treatment process. The bottom line is just make sure that you lose whatever weight you want to lose before you have those surgeries. Try to get within 10 or 15 pounds of that goal weight before you have surgery. The other important thing is all of those medications kind of affect your nutrition and how much you're able to eat, which then means how much protein you're getting. That directly affects your wound healing. So even if you stop those medications, you need to make sure that you eat an adequate amount of protein for your body weight to be able to make sure that you have enough nutrition, that you're able to heal the incisions, and that you don't have poor wound healing or other complications in the immediate post-op period.
No matter where your surgery is done, from head to toe, no tanning or sun after surgery for 4 weeks. After 4 weeks, if you are going to go in the sun, it's important to put SPF 50 or above on any incisions, even if they're below the bikini. The sun rays can go through clothing and still cause darkening of your scars. After surgery, we want to ensure that you have the quickest healing possible and make sure that there's no medication interactions. A lot of supplements can cause inadvertent bruising, bleeding, or interact with the medications we prescribed you. The only medications or supplements that you can take have been advised to at your pre-op appointment. The only vitamins that we recommend or allow are a multivitamin for 4 weeks after surgery.
If you're having surgery, regardless of what surgery it is, you're going to have a coupon book that you go home with. One of the things in there that's important is discounted scar treatments. Those can be very important to make sure that you heal as best you can and that the scars look as good as they can. Your esthetician or nurse practitioner that you see will kind of know the best timing as far as when they want to start each one of those individual things.
Common treatments our estheticians provide for scar care are microneedling, laser therapy, and also pharmaceutical grade medical skincare to help for the best scars possible.